What up? It's the PAC, man. All things physician associate. And this is part 2, man, of a 2-part series, PA versus NP. Let's get to it. So, picking up where I left off. So, the PA versus nurse practitioner autonomous practice. So, currently, right now, let's use urgent care as an example. Both a PA and a nurse practitioner can open an urgent care right now. Both of them. The difference lies within the liability itself. So the nurse practitioner has the license to assume 100% liability. That means if anything goes wrong, that nurse practitioner can say that's on me, man. The PA license does not allow the physician associate to assume that liability yet. I say yet because, as far as Florida goes, like the physician associates are lobbying this year for 100% autonomous practice. And so, things could change at any point. But currently, as of the recording of this video, a PA cannot assume that liability. So what happens then? Well, that means you need to find a medical doctor to assume the liability with you. Like a son asking his dad to co-sign to buy a car. Like, Dad, credit's not good enough. Can you co-sign with me? No. Son, I'll give you a kidney before I give you my credit. All right, whatever. So you need to find a medical doctor to sit on your board of directors, right? They are directing they are the overseers. And a doc will tell you, hey man, I'll co-sign with you. You're gonna have to cut me a liability check, right? I'm assuming so much unnecessary liability, it has to be worth my time. So a doc could easily say, hey, I want $75,000 a year to sit on your board of directors. It's nothing but a signature once a year. And but that signature is gonna run you, let's say, $75K a year, with the contingency that as the business grows, they may want more money. And it is what it is. Currently, if a PA wants to open a practice, that's just something you got to consider, right? So both of you can open a urgent care, but one of you already comes in with this extra overhead expense. As far as controlled substances go in the prescribing, both PA and nurse practitioner can get a DA license and prescribe controlled substances. Currently, that's something that passed in, as far as PA profession goes, the ability to prescribe controlled substances went into effect in like 2018. So and there was some restrictions as well. So for a nurse practitioner, no restrictions. A nurse practitioner can prescribe any and all drugs. And then the PA can prescribe almost all drugs. The 3 exceptions, I think I only remember 2 off the top of my head, but the 3 exceptions were a PA cannot prescribe chemotherapeutic drugs. So at first I thought I would never give a patient chemo drugs anyway. I'd refer them to oncology. But then I started thinking, I was like, don't I have a friend that's a PA? She's that's a PA in oncology. And I was like, well, what does she do then? Like, how that's part of her day-to-day is to, like cancer patients come in for their follow-up visit and they need refill on their drugs and you can't prescribe them. So I thought, that one's probably limiting. That's weird though, but whatever, sure. Another one is a PA cannot prescribe lidocaine when it's to be used for epidural. I was like, okay, you guys are just being weird. Like, first of all, I don't know any PA who's putting in a prescription like, here, take this lidocaine home or what have you, and for epidural. Like, if for anesthesia is doing the epidural or pain management or what have you, like, I can't. That's something you don't prescribe lidocaine for epidurals to a patient, at least not to my understanding. That's something that it's a procedural type medication. So I don't picture where that's needed, but whatever. I'm sure that's what they came up with, and that it is what it is. And then there's something else that PAs can't prescribe that was also kind of odd. I can't recall right now. So that's pretty much it. Everything else is a go right now as of 2018. So all that, you know, benzodiazepines are good to go. You know, opiates, good to go. So so there's really no difference there. When you think about your day-to-day drugs like prescribing a patient Xanax or Percocet, like that, it's either way, it's a go. Just know that the state of Florida, and due to the opiate crisis, it's not like you could just start prescribing them like they're candy. You know, there's a lot of restrictions for everyone. Even for primary, you know, family medicine doctors, they all have restrictions now. You're advised to refer to pain management. If you have pain that's chronic, you need to send them out. If it's acute pain, you need to go to the ER, and the ER doctors even have a limitation as to how much. They can definitely get you started on some, let's say, Percocet, but they can't just give you enough Percocet to hold you down for a couple months. No, here's enough to get you to pain management, and then pain management will have to prescribe you chronically. So everyone has restrictions, right? Regardless of what position you're in, as far as controlled substances go. Okay, so let's see. So that covers the autonomous aspect of it. That covers the controlled substance aspect of it. And let's see, what else did I want to mention with regards to the two professions? I think that was just about it. So I guess I'll just summarize on the two. I think both of them are awesome professions. It really truly just depends on you as an individual and what type of what type of provider you want to be, and just really just know that both of them essentially, you can find a PA or a nurse practitioner anywhere. Both professions are expected. It's like 30% growth by 2030, so, or more, 30+%. So both professions are rapidly growing, and both professions are highly sought after, and and lucrative, and I think either choice you make is a great choice. It really is just solely dependent on you and your long-term goals. I certainly wouldn't choose one over the other for monetary reasons. As I mentioned, there's no difference there. I definitely wouldn't choose one over the other for the sake of autonomous practice, because quite honestly, I believe that it won't be very long before the PA is autonomously practicing. I think I would choose them primarily on the type of medicine you want to learn. If you want to be more patient-centric, then I definitely go with the nurse practitioner route. If you want to be more disease-centered, I would definitely go with the PA route. If you close your eyes and you envision yourself working in a hospital setting, consider the nurse practitioner route, because while you're on your way to get that nurse practitioner degree, all those years leading up to it, you're a registered nurse working in a hospital, so you're gaining that hospital experience and building those relationships. I think if you envision yourself working outside of a hospital, like in a private practice or urgent care or just anything outside of the hospital walls, then I would consider PA, and solely because of the just the amount of information that's stored in your brain really allows you to just kind of develop differently, not better, just different. All right, neither of the profession is better than the other. I love and respect the nurse practitioners that I work with. I love and respect the PAs that I work with. And I think both of them are just brilliant. I lean on both of them whenever I don't know anything. I walk up to the first mid-level provider I see and say, hey man, this is the case I got, and this is where I'm stuck, and what do you think? And both of them, their brain is just wired differently, but they both get to the same conclusion. So it lets me know that this is pretty good. Like you guys truly are like highly trained, either profession. So either way, man, that's all I gotta say, man. So if you guys have any questions with regards to the PA profession, anything you want to add, you can leave in the comment section. Any questions you have, you can put it in the comment section. I'll be more than happy to answer them as I see them, man. Love you guys. Stay blessed.